Hello, hello. Welcome to the Healthy Heart webinar with me, myself, Leslie, and the one and only Dr. Scott Saunders. Sorry,
Hello.
not the one and only. There is
Oh,
another Dr. Scott Saunders. I always forget,
yes. He's a
but there's really none like
psychiatrist
you.
in Chicago.
Oh, interesting. Maybe you guys could team up someday.
Yeah.
Uh, Anyway, we're excited to have you guys here. Welcome to the Healthy Heart webinar. Today we are talking about high blood pressure. And boy, does this come up a lot. High blood pressure actually comes up on our diabetes webinar. Yesterday, for those of you who don't know, we do a webinar on Wednesdays where we talk about type 2 diabetes. And someone had noticed that their blood pressure goes up when their blood sugar numbers rise. And I thought that was really interesting. We've talked about that before, but there are so many things that seem to affect our blood pressure. And so many people have questions. Dr. Saunders, he's brought about some interesting, we'll call them, he's addressed some myths. And so today I want to talk a little bit more about those things. What does high blood pressure mean? When should we be concerned? Should we be concerned? And let's get to the truth about this. Let's talk about it. Again, and before we discuss this, Dr. Saunders is a medical doctor, but he is not your doctor. So please consult with your medical provider before you implement any of the things that we talk about today. Okay, Dr. Saunders, let's dig in. High blood pressure explained. What do we need to know?
Okay. So you mentioned a word called truth, and truth is not found in anything like of the world of science. So the truth, look to God for truth. I am not that. So what I'm going to tell you is what our current understanding is to give you an idea of what blood pressure is and what it means, and because it's really different than we've been told all of our lives, and everybody thinks that if your blood pressure goes up to 150, you're going to pop a blood vessel and stroke out, and you're going to be totally numb on one side. That's not the way the system works. It's just not it at all. In fact, if you look at the amount of pressure in your arteries, is it's really small. Okay, you have you ever pumped up your tire in the car? Even with like a pump, a hand pump, how much pressure are you putting in that tire? Um, you're putting in about 30 to 40 pounds of pressure. That's pounds per square inch, right? Um, and then so if you have a bicycle tire, especially if you have a racing bike with those little skinny tires, those are like 60 to 70. I've seen them as high as 80 pounds per square inch on those of pressure in those tires. They don't hold a lot of air and they don't have a lot of square inches, but they got a lot of pounds. And so why is that? Because you need it's per square inch, so the amount of contact with the road is the if you have 1 square inch of road, it has to hold up, my 160 pounds and plus the weight of the bike. And so if I only have 5 pounds per square inch, then everything's going to go flat. I have to have enough to hold it up, right? Well, your blood pressure is a very similar kind of process going on. This is fluid mechanics. And in order for that blood to flow through the blood vessels, you have to have a certain number of pounds of pressure more on one side than the other so that it goes towards the low pressure side. And that's what's happening here. So how does that work? Plus, you have to think about, have you ever tried to suck a triple thick strawberry shake through a soda straw? Uh, we used to do that at McDonald's. I was like, when I was a kid, I don't do that anymore. But anyway, so and then we would do stuff like take those little coffee stirrers and try to suck it through one of those. And you can't even get it through the coffee stirrer. If you have plain water, it'll go through, but that thick, shake or something isn't going to go through the coffee stirrer. Well, your blood vessels are like that. That's your blood vessels are. this fluid has to move through there. And guess how much pressure is there? Does it have to be, oh my gosh, 80, 100 pounds of pressure to, get it through those little teeny microscopic blood vessels? No, 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 no. So your blood pressure is what? 120 over 80. Let's just say it's 120 over 80. Okay. What does that equate to an equivalent of like what you're pumping up your bicycle tire with? Um, four. 4 pounds per square inch. If you've ever seen anything 4 pounds per square inch, that's not a lot of pressure, especially when you have very few square inches. I mean, how many blood vessels do you have that are 1 square inch? One, your aorta, that's it. Every other blood vessel is less than 1 square inch. So there's less than 4 pounds pushing it through the littler ones. Then the little ones, by the time you get to the microscopic ones, you have such a tiny amount of pressure. It's incredible that anything moves. And I'll tell you why it does in a minute. But first, I want to tell you about that everybody's worried about their blood vessels rupturing. So let's say you get your blood pressure goes up to 200 over 100 and you go to the dentist. I've seen this happen, that's why I'm using it. And they do your blood pressure, and they say, oh my gosh, it's 200 over 100, call 911. And they call 911 and send somebody to the hospital because their blood pressure is 200 over 100. Oh my gosh. When I go into the dentist, my blood pressure is 200 over 100. And I always tell them, don't take my blood pressure. Don't, because you're just going to screw everything up by doing that because I'm really nervous when I go in there. So, that's not it. So think about how much pressure that is. That's 8 pounds per square inch. 8 pounds. So how many square inches do you have in your blood vessel? Not very many. Let's look at an equivalent. Does an airplane, like you have this airplane, right? And they're pretty big, and they pressurize the cabin. So when you're 30, 40,000 feet in the air, how much pressure is actually inside there, keeping you pressurized to a normal level? It's not really normal. You're about 8,000 feet, you're not really pressurized to a sea level, for example. But even then, when you get up to 40,000 feet, there's about 11 pounds per square inch on the skin of that airplane. What does that mean? That means those little windows that you're looking out of, about 10 by 10, 100 square inches, that has 1,100, 1,100. That's over a half a ton of pressure on that one little window, right? That's a lot of pressure. And so remember that Alaska Airlines plane where the whole side blew out? They did a repair and the side blew out right as they're in the air, right? And these people are sitting in the seat with their seat belts on, and there's no wall by them. There's no and that's because that's a lot of pressure. The repair they did was like 50 inches by 100 inches. So that's like, 10 tons of pressure on that one repair in the pressurized airplane. So that's why people worry about, oh my gosh, my blood vessels are going to explode if I get up to 200. No, think about it. 200 is what? About 8 pounds. It's less than eight. It's like 7 pounds per square inch, and you have very small square inches. So you can tolerate those few pounds. How do you know that? Well, here's how we know. Um, when doctors, surgeons want to repair a blood vessel in an artery, for example, let's say they do a bypass surgery on your heart. Where do they get those blood vessels? From some thick-walled, really strong artery somewhere in the body? No, no. They take a vein out of your leg. You know what a vein is? Vein handles a less than 1 pound per square inch. Vein handles, in fact, there's no measurable pressure in your veins. It's only as you're moving around and doing things, your muscles massage the veins. The veins have muscles in them that help. They have valves in them that allow the little bit of blood that's moving up to go up and then stop, and then go up to the next level and stop, and then go up to the next level and stop. And the valves do that. So there's just like almost no pressure in a vein. And the surgeon will take a vein out of your leg and put it into your artery where you have 120 millimeters of mercury to, let's say, you get a high blood pressure, 200 millimeters of mercury. Do the veins ever pop? Nope, never happens. Nope. Oh, it can pop where the repair is. That's happened. But the veins themselves don't get aneurysms and pop with a hundred times more pressure than they've ever had in their lives. That's not the way the system works. So all of this worry about, oh my gosh, your blood pressure is 200 over 100, you better go to the ER, is all misguided. It just doesn't even have anything to do with anything. So why do people get high blood pressure then? What the heck? And what does it mean? Okay, now we can get to the bottom line of physiology. How does our physiology works? Let's take an example. Your brain needs a certain amount of blood flow. And so when it needs less blood flow, it drops the blood pressure. When it needs more blood flow, it raises the blood pressure. That's the only way your brain has of getting more blood flow. So let's say something happens like you have, like yesterday. Yesterday, I had a patient who came in. We had some tests done because she actually had a stroke. And we had tested her before, and her arteries were clean. We did ultrasounds, the artery was clean. But come to find out that an internal carotid artery that couldn't be seen on the ultrasound had lesions in it, and so it was narrowed. And her blood pressure was uncontrollable. That's why we were doing all these tests. We're trying to find out why her blood pressure was uncontrollable. I mean, like 200 over 111 all the time, like that kind of high blood pressure. And so we did tests on the kidneys, we did tests on her heart, we did carotid ultrasounds, and her coronary calcium score that we've talked about, right? Yeah, she's got to have a bunch of heart disease, right? Her blood pressure 200 over 111. Zero, zero, none, not even a tiny bit of calcium, nothing. So what the heck? How did she have a stroke? Well, the reason her blood pressure was elevated was because there was a stenosis, meaning narrowing of an artery inside actually her posterior circulation, cerebral circulation. And because it was narrowed, there was less blood getting to that part of the brain. So then that part of the brain is saying, give me more blood. How does it do that? Well, obviously raise the blood pressure. That's all you got to do to get more blood, right? Give me more pressure and I'll get more blood. That's what the brain does. So her blood pressure was high, 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 high. We're looking for the cause and we don't know where it is. The kidneys are fine. The heart's fine. The carotid arteries are fine. We didn't see what was happening inside of her head. We could have. That would probably be the next step, to do an MR angiogram of the head and find out, where's the stenosis here. But it took having a stroke for us to find it, because then they did the angiogram and then it was, aha, there's where the problem is. And that's why your blood pressure is high. So the blood pressure is high because there's a problem. So when you have high blood pressure, ask the question why. So you have primary hypertension, and that's what most doctors diagnose. If you have high blood pressure, they say, oh, that's just because that's just the way you are. You were born with it. Then there's secondary high blood pressure, and that means your blood pressure is high because you have a narrowing, a stenosis of the artery in your brain, or a stenosis of the artery to your kidneys, or you have stenosis of the arteries in your heart. When you have some kind of lack of blood flow, your body raises the blood pressure so that you can get more flow. That's what it does. So the blood pressure is always secondary. Secondary means there's a reason why. It doesn't just happen out of the blue. So when someone comes to me with high blood pressure, I don't say, oh, here's a pill for your high blood pressure. Take this and your blood pressure will go down. Um, that never addresses the reason why. So instead of giving people medication for high blood pressure, I ask the question why. Unfortunately for this one, she's okay. She's recovering from her stroke really well, and is practically normal now. But still, it took that to find out where the problem was that was causing the high blood pressure in the first place. Why is
So
that
is it,
important? What?
well, is that the traditional thing? If someone has high blood pressure, they go to their medical doctor and the doctor does just give them a drug. Is that typically what happens?
Yes. That's the
Okay.
norm. That is
Okay.
called the standard of care. So the standard of care is you walk in with high blood pressure and somebody hands you a pill and says, take this. And then you come back and says it's not working. And they say, aha, take this, and add it on to the other one. And then you come back and say it's not working. And they say, aha, take this. And they add it on to another one. I've had people on 5 blood pressure medications and still not be controlled because this particular gentleman had renal artery stenosis. And so, but even when it's controlled, it could be a problem if you're using medication to decrease the pressure. Then you're going to have what? Less pressure, and less blood flow to the whatever part of the body that's needing blood flow. And so if it's in your brain and you drop the blood pressure, then your brain's going to have less blood flow. What does that mean? Dysfunction. You're going to have less function of the brain. So you're going to cause problems by doing that. And is that a real thing? Does that actually happen? Well, yes. When I was in medical school, they were doing studies in ERs about strokes. They were just starting these new programs of we're going to have a neurologist on call for strokes. We're going to have an OR set up already to go in and give people something called TPA that dissolves clots. So we're going to give them a clot dissolver immediately. We're going to have an MRI scanner ready to find out where that clot is. So if someone comes in with a stroke, they immediately go in an MRI scan. They got a neurologist evaluating it. They got a radiologist evaluating it. Go, you got a clot right here in your artery. They go in the OR. They give them the TPA that dissolves clots. The clot dissolves, and it works. It works. It's really good stuff. So they started doing these programs. And what they were finding, though, that people would come in with their blood pressures being, like 200 over 120. Their blood pressure was like that. They're like, oh my gosh, no wonder you stroked out. That must be the reason. And so they would give them something called sublingual nifedipine. And they put it under the tongue. They actually pop it and squeeze it under the tongue. And the blood pressure just comes down like crazy. And people died. And then they did it again and people died. And they did it again and people died. And again and again and again. And for years they did it and people were dying like crazy. And they're going, gosh, how come people with strokes are dying more than they used to? And someone said, well, I wonder if it could be the nifedipine. No, that wouldn't be it. And so people continued to die. Finally, they figured it out after years. They figured out that, oh my gosh, when they looked at the difference between people getting the nifedipine versus not getting, there was a huge difference. It was like, oh my gosh, we've been killing all these people with strokes all the time. By what? By dropping their blood pressure to normal. That's what they did. That's how they killed people, by dropping their blood pressure to normal. We see the same thing with diabetes now. People go into the hospital and their blood sugars are super high, 300, 400, and they say, "Oh, give them insulin until they're normal." And those people are dying too. And that's currently going on right now. The one of the recent studies was evaluated, said, "Oh yeah, people do die when that happens, but they're still doing studies to see if that's the actual reason for it." So, it takes a long time to figure these things out. Um, the idea of just dropping your blood pressure without knowing why, could be dangerous for your life. So, if you don't know why, don't drop your blood pressure. Keep your blood pressure high until you figure out why.
Oh,
Hey,
that's
that
good.
rhymes. I'm a
That's
poet.
good. And it's also a reminder just how intelligent your body really is. Your body's doing things for a reason. We just have to figure out why. Instead of just
Yeah.
trying to give it drugs to change it, let's dig in and figure out the reason. And that's why we like you so much, Dr. Saunders. You're always asking why.
Oh,
You're always
that's sweet.
curious. Yeah.
Yeah.
Well, and that's why all these people keep coming back to the webinar because they know that you're not just going to settle for, okay, here's the thing. I think that drugs are sometimes needed, depends,
Yep.
but that's not usually maybe the best option, I would say. There's usually a reason, so it's good to figure out the reason why.
Well, once you
Um,
figure out the reason why, and you find out that you have an imbalance in your recently I had somebody with an adrenal problem, and he's on medications, and
yeah,
they work, and he's
yep,
good, and
yeah,
it's
right.
okay.
I like Dwayne says drugs are the last resort, and in a lot of cases they can be. But it's funny. I feel like sometimes you're a medical doctor, so I feel okay saying this to you. But sometimes we think we're going to go to a medical doctor and not get medicine, but that's what medical doctors study is medicine. And so we
Exactly.
can be shocked when that's what they give you. That's what they do. That's what they do. But there are many doctors like you who you want an assortment of options for things that work for people and look to see what the best options are for the individual and what's happening in their body. And so that's good. Okay. Dwayne said, feel like a guinea pig much. Yeah.
Well, you know what? You don't realize it, but we're all guinea pigs. When you go to a doctor and you say, I'm depressed, and they say, oh, here, try Prozac. Do they have any reason to give you Prozac? Do they know anything about your neurotransmitters and whether your serotonin levels are too high or too low, or your dopamine levels? They don't know anything about that. And so um, it's always an experiment. Let's see, try this. Does it work? Oh, no, that doesn't work. That made me feel bad. Oh, okay, here's try this one. See, does that work? Oh, no, that made me feel bad too. Try this one. Oh, yeah, that works for me. That kind of thing that's the way medicine is done. And so if you think of it like a guinea pig, yeah, in a way, we're all being tested.
Yeah. Well, that was very good. Very interesting. I'd be curious if any of you maybe are using high blood pressure medication. If you had gone to the doctor, said, I have high blood pressure, and they gave you medicine and you still don't know why. It'd be great to hear from you. And Dr. Saunders, if people are here watching today, what would you recommend for them? You said go figure out why. So where do you start? You go back to your doctor and say, okay, why?
Yeah, why? Yeah. And so if they don't know why, go on the internet or like ChatGPT, go into ChatGPT, and ask for what are the secondary causes of hypertension? And you'll get a list of all these kinds of things, hormone imbalances, adrenal problems, brain problems, pituitary problems, kidney problems. And so you'll have this list of things, and then you go into the doctor and say, "Here, which one of these is causing my high blood pressure?" And if he says I or she says I don't know, then they say, "Okay, let's find out. Let's
So
find out."
in your practice, what do you find is typically the reason that someone's high blood pressure or most common? Why do they have high blood pressure?
Oh my gosh, there are over 100 different reasons why you could have high blood pressure. I have had people with high blood pressure because of lead toxicity. I've had people with high blood pressure because of renal artery stenosis. I have found out people have a genetic kidney problem, polycystic kidney disease, because their blood pressure was high because we started looking for the reason. I've had people with adrenal tumors. I had somebody with an adrenal tumor. I had someone else with a pituitary tumor in his brain that they took out the pituitary tumor and he's perfectly normal. Adrenal tumor, same thing. They took out just he has two adrenal glands, right? So they took out one of the adrenal glands and he got all better. Um, I've had people where I couldn't figure it out and I just put them on medication. Because I don't
And it's
know.
working.
But But
Yeah.
see this woman that I was telling you about that had the stroke, I couldn't figure hers out either, and it wasn't until she had a stroke that we figured it out. Otherwise, we wouldn't have known. Because I don't generally do MR angiograms on people's brains, but I guess that would have been the next step, and I'll probably do that if it's like a big mystery in the future. I'll probably just do an MR angiogram.
Very interesting. Okay. Has anyone commented about this? Let's see. Dwayne says, shouldn't it now be something that doctors use Chat GPT? Yeah, they probably do.
You know what? I think all these medical sources, because I read the literature from the doctors, and all these medical sources are saying, ChatGPT is horrible. Tell people not to use it, that they could get bad information and all that. And really, it is useful. So, for example, I use it all the time to give me what are the options? What are all the possibilities? And I'll go, no, not that one, not that one, not that one. Oh, here's something I hadn't thought of before. And just because it gives me the options, I can look at things that I may not have thought of for this, particular patient or something. I think it's so useful.
I wanted to see, what did Dwayne say? That's called Chat GP waifu. Okay. Let's see. And here's something from Anne. This is my fifth day of fasting, and my blood sugar was 98, and my blood pressure is 115 over 77.
Nice.
Yeah.
Nice. Okay, so that is a beautiful blood pressure and a beautiful blood sugar. Fasting is just so good. The blood pressure comes to normal for almost everything. If the blood pressure doesn't come to normal when you're fasting, then you've got something. You've got an adrenal tumor, or, there's a reason for it that you really have to find out why.
Yes. Dwayne said, I just did a 65-hour fast over the weekend. Wow.
Wow, good.
uh it does kind of make you wonder how many things, and we talk about this a lot, but boy, if your blood pressure is high and you don't know why, it's almost like, should I start just fasting until I can get in to see somebody to do some testing? Because it seems like fasting really does help a lot of things, and it
Yeah.
just, I don't know, I almost think that that'd be where I would start while I wait to get my testing done. Just fast. Not that it's going to correct everything, but it's a good option.
Good
Uh,
option.
okay, let's go into some more of these questions here. All right. Okay. Okay, this is a good question. Alice says, can you go cold turkey off of blood pressure meds under a medical guidance, of course?
Um, Blood pressure medications work for hours. Hours, that's it. So don't consider that you have to wean off of them or anything. If you're taking three or four of them, for heaven's sakes, don't stop them all cold turkey. But if you stop one, follow your blood pressure for a week and go, didn't change. Okay, stop another one. Follow your blood pressure for a week. Didn't change. Stop the third one. Follow your blood pressure for a week. And yeah, if you stop it, and now that you have access to doing your blood pressure as often as you want, you have your own cuff, carry it with you. I have somebody that takes his blood pressure. Oh my gosh, he can take his blood pressure as many as 30 times a day. And sometimes even more than that. But usually the least amount of times would be like two or three a day, but up to even more than 30 times a day. This guy. So having a blood pressure cuff allows you to take your blood pressure as much as you want. So then that way you can assess. You always know what you can see. So you don't have to worry about what's going to happen if I stop the medication. Take your blood pressure. Find out. It's easy.
Right. All right. Well, I think we had a couple comments about going to the dentist, which I thought was really funny.
Good.
Dwayne said, I white knuckle it during a dental visit as well. My blood pressure must be the same, 200 over 100. And let's see. There was another one. Lily said, I went to the dentist yesterday and my blood pressure was 97 over 64. Is that worrisome? Age 80.
Oh, age 80. Okay. Yeah, that's low. Worrisome? Well, not in the immediate sense. I think from that point, you say, okay, maybe my blood pressure's low. Maybe it's situational. Just take your blood pressure periodically. If you take it at morning and night, like 8 a.m., 8 p.m., and keep a record of it. And so you can assess, you go, wow, they always seem to be pretty normal. 140 over 75 would be for an 80-year-old would be a perfect blood pressure. So 140 over 75. It's always 140 over 75 in the morning. That's when the cortisol goes up and the blood pressure is a little higher because you have more adrenaline, epinephrine. And then when you're quiet and relaxed in the evening, it would tend to be lower. And so, 100 over 60 or whatever, that would be an okay thing. But if it's consistently that low and you stand up and get dizziness and feel like you're going to fall down, then it would be a good idea to find out why. Because it could be something as simple as hyponatremia, low sodium, not getting enough sodium. And that could be a hormone imbalance called aldosterone from your adrenal glands. So yeah, find out why.
Taking some notes here. Hold on. Hopefully, you guys are taking notes too. There's a lot of good information here today, but have no fear. You can rewatch this. It's recorded on YouTube. So if you go to our Barton webinar channel, you will be able to watch all of our recorded webinars. In fact, I'll post a link to that so that you guys have that. Okay, let's go dig into some more questions here. Let's see. Robert has a question, I think, about blood sugar. Okay, for quite some time, my blood sugars have run from the 140s to the 180s. I received my Synachroma 6 days ago and started taking them. Less my blood sugar 4 times per day, morning fasting, and after every meal. In the last 5 days of checking my sugar 4 times per day, the highest reading has been 116. Most of them were close to 100. I asked my VA doc if I could begin lowering my metformin and insulin, and she said no. She is of the mindset that the medications are the only way. I want to get off these medications regardless of what she says. What would be your recommendation of how to get off these medications? So let's just quick overview. So blood sugars have gone from 140s to the 180s. That's where they were. And started taking Synachroma, measures 4 times a day. And now most of them are close to 100.
Yeah. Yeah. Okay. So dang, it's kind of hard because you need someone that you can work with, some practitioner, a doctor that you can work with that can help you to get there. Doing it on your own is possible, but when your blood glucose starts getting low, then it'll be imperative, it'll be necessary to stop. So for example, if you go on phase 1 of the diabetes solution kit, so not in the heart health kit, but the diabetes kit, start doing phase 1, and your blood sugars start getting too low, then you tell your doctor, I'm getting hypoglycemia. I'm really worried, and then they'll tell you to stop the insulin. That'll be the first thing. Metformin doesn't usually cause hypoglycemia, so that wouldn't be an issue. But metformin you can just stop on your own and take berberine. I mean, anybody can do that. That's not an imperative. It's essentially just trading across from one pill to another pill. It's still a pill. So anyway.
And you want a doctor that would be celebrating with you that your numbers have gone down. That should be exciting. They should be proud of you, excited. So hopefully you find a doctor that will do that. All right. Robert says, good morning. With regards to omega-3 supplements, how important is DPA for heart health? Most labels I read just have EPA and DHA.
Okay. This is really interesting of the way um, because of the commercial nature of our society, we parse out everything and say, what is the active ingredient in this? And take it out. So you take turmeric, for example, which is an awesome herb. And then you say, what is the active ingredient that decreases inflammation? And they say, it's curcumin. And so they extract out the curcumin and say, this is the active ingredient. Here, take this. And they're not thinking about the hundreds of other different uh, 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 glycolipids and bioflavonoids and all of the other things that are in the turmeric that actually kind of help that to function well. What is the active form of vitamin E? And you say it's D-alpha tocopherol. And so they take that chemical and they give you that chemical and say, this is the active ingredient. And they don't think about how important it is to have alpha, beta, gamma tocopherol and tocotrienols, all of which serve a different function, of a partial function, and have some activity actually. Vitamin C, the same thing. Well, guess what? DHA, EPA, all those omega-3 oils, same issue. Your body converts, if you take arachidonic acid, your body will convert it into EPA, DHA, DPA, all of those. And you have that ability to convert it in every cell of your body. This is not just something that only happens in your liver, for example. It primarily happens in your liver, but all of your cells have the enzymes to make these conversions depending on what they need. So if you provide omega-3 oils, then the omega-3 oils that we can't make can be converted into the other omega-3 oils. So if you have one, you can convert them to the others. So yes, you know that this EPA, DHA, you have to have extra DHA for your brain function, or you have to have that EPA for your heart function. Well, guess what? If you never ate any of those and you had enough arachidonic acid, then you'd make all the other ones anyway, and you'd uh, draw the blood and look at somebody's cells and go, oh yeah, you've got the EPA, DHA, you've got them all. So, I think that the spectrum is important, and that's why I usually recommend fish oil and not the distilled, just take this is your DHA, take that one, and here's your EPA, and there's a separate one for the DPA. Um, that instead of that, having the fish oil gives you kind of a broad spectrum and a better, I think it contributes to a better functioning system.
Norman
Just
said that he is on blood pressure medication. I was given, but I don't think he knows why. Should I stop now since I'm on Barton supplements?
no, don't stop your blood pressure medication unless your blood pressure is normal. And so if your blood pressure is not normal on the medication, that's a really good reason to go back to your doctor and say, okay, here's the list I got from ChatGPT of
Yeah.
secondary causes of hypertension. And so which one do I have?
Yeah. Okay. Beverly said, I told you yesterday that I'm taking a diuretic, an ACE inhibitor, a calcium channel blocker, and an alpha agonist because docs kept adding meds for hypertension that wasn't controlled. Last week, I
Right.
started taking healthy heart support, and after 35 years, my blood pressure is now normal. Should we still investigate? Maybe I could drop all those meds.
Okay, that's a possibility. So let's say, for example, you have a problem with making enough um, nitric oxide. Like, let's just say that. Okay. So you're taking all the medications that you're taking don't deal with that at all. But the supplement does. Supplement actually adds nitric oxide. So now all of a sudden your blood pressure is normal. And that was the problem, and you fixed the problem. So then do you need blood pressure medications? Well, no. So you do kind of the same thing. You go off one and then another. Wait a week in between them and keep a record of your blood pressure. And if your blood pressure is going up, then you still need to know why. But if it's controlled under normal circumstances, then you don't. Then you don't have secondary hypertension.
Okay. And Beverly said, and how can I tactfully discuss this with my doctor?
I'll just say, I'm the boss of my body and I want to know this. How can I find out this? What test can we do for this? Just, ask the questions. This is what I'd like to know. How can I do that? You're my expert. I need your help.
And maybe you can say, you've done such a great job. Thank you for all of your help. I'm having success. I don't know. Okay. Anonymous says, does one have to minimize their exercise routine during a 3-day fast? Good question.
No, good question. No, don't decrease your exercise. Why? Because studies have shown that people who fast and lay around use muscle for energy. They're taking the protein out of their muscle. You don't want to take your protein out. You want to do what's called autophagy on the junk in your body, the tau proteins that have collected in your brain and all the amyloid proteins that have collected all over your body. You want to take out the trash proteins, not use your good muscle protein. So in order to stop from using your good muscle protein, all you have to do is exercise during a fast.
All right. Julie says, what about blood pressure medicine if you get dizzy because you're doing phase 1 and lowering your blood glucose? Isn't it if you get dizzy or lightheaded, probably a result if your blood pressure dropping, if I'm on blood pressure medicine? Because the doctor finally did drop the blood pressure medicine in half because of that dizzy lightheartedness, because that was happening. I actually got a serious case of vertigo after that for a month. So isn't it important to lower or even get off blood pressure medicine then? My blood pressure is probably lower than it needs to be as a person who is 65 now, and they want to bring it down to 120 like it should be for a younger person too. And then
Yeah. Okay.
isn't blood pressure medicine not helpful if not needed, really?
Okay. So, yes, blood pressure medication is actually counterproductive if your blood pressure is normal or low. And you don't want to lower your blood pressure. If you're 65, you don't necessarily want your blood pressure to be below 140 anyway. The optimum place to be is 140. You can be down as low as 120, but you definitely don't want to be lower than that. And the key is what you said, and that is if you're getting lightheaded, then you have too much. Your blood pressure is too low. And so that is an important thing to deal with. I have that the person I was telling you about that takes his blood pressure 30 times a day. He records them and he graphs them and sends me graphs. I wish I had one with me. It's a
That's
very
cool.
interesting graph. But his blood pressure was bouncing up and down, and he said, it gets too high sometimes. I think I should take medication. So he starts himself on medication, amlodipine for high blood pressure. And what happened was his blood pressure came down, and instead of bouncing around, it became very kind of stable. It just stayed at the same every day. And it didn't go as high as it was going, but it like reached a ceiling and it just stayed there. And that's not the way our system is set up. Remember, I told you about how the brain gets more blood flow? How? By raising the blood pressure. So if you stand up and you start running around and your brain and your blood vessels dilate in your body and your brain's not getting enough blood flow, you're going to raise the blood pressure and it's got to go up so that your brain can get more blood flow. What if you take a medication and you can't get more blood flow? What's going to happen? Well,
Yeah.
dizziness, lightheadedness, And what's an interesting thing is, if it's not that bad, if it's just a little low, then the brain shrinks down over time and shrinks and shrinks and shrinks. And so, if you talk to a radiologist about, that do MRIs of the brain, they will say normal brain shrinkage for age. And it's like, why is anybody's brain shrinking?
Yeah.
Because the brain is like a muscle. Why do my muscles shrink? Well, it's because I'm not using them.
Yeah.
They're not getting enough energy. If they don't have innervation, they're going to shrink. I'm going to lose muscle mass because I'm not using it. Well, the brain's the same thing. If you use it, it grows. If you're not using it, it shrinks. If you didn't play the piano and you took up piano lessons, the before and after MRI scans would have measurable enlargement of the areas of your brain that are for playing the piano. And so normal shrinkage for age is a terrible thing to say. That's like, oh yeah, we expect that to happen because people don't use their brain.
Wow.
But a lot of that has to do with low blood sugar and or low blood pressure. So when you have those symptoms, when you're having those symptoms, it could be low blood sugar too, or low blood pressure.
Hmm. Okay, Rita says, I am taking Carledovil, Carledovil,
Carvedilol.
okay.
It's a beta blocker.
Oh, I know this one.
Amlodipine,
Amlodipine and losartan, which
losartan.
which drop first, all for high blood pressure.
I'm not your doctor, remember?
If
Uh,
you were, yeah.
okay, if I had a patient that came in with those three medications, losartan, amlodipine, and what was the last one? What was the first one?
The cardiolog, whatever.
Carvedilol. Okay, I would first stop the carvedilol. I would amlodipine, carvedilol, and losartan. The losartan actually is probably the last one I would drop. Yeah. Losartan has good effects, even if people don't have high blood pressure. In fact, some people are using it as a repurposed drug for longevity,
Mm,
because of that the renin-angiotensin system has bad effects on the body, and it kind of blocks that. So
mm.
um, it's better to fast. You get all the benefits and more from fasting, and you don't have to take a pill. So I don't know.
Okay. Beverly says, I have been reading that krill oil is better than fish oil. What do you think?
Okay, thank you for asking that. So fish oil is primarily omega-3. Krill oil has some omega-3. It's usually less potent in omega-3, and it has other oils in it. So the other oils are um, uh, uh, triglycerides they're okay, they're good, but they're not essential fatty acids. So the purpose for taking the fish oil is to get the omega-3 because that's the thing that's deficient. In other words, because we eat seed oils and vegetable oils, and we eat grains and nuts, and all these things that are like sesame seeds are really high in omega-6 and they don't have any omega-3. And it's really hard to get omega-3 in our diets. So our purpose for taking these oils is to get omega-3 specifically. So in spite of all the good benefits of krill oil, it is really relatively lower in omega-3. So you just have to take more krill oil to get the same benefit. Our benefit is omega-3. So that's why I prefer fish oil over krill oil.
Okay. And if you're interested in purchasing some omega-3, we do have that at the Barton Nutrition website. Use code webinar25 to save 25%. You can also get there by going to bartonwebinar.com. So I did post that in the chat as well. Douglas says, I also have a VA primary and coronary doctor that are both fixated on medication, that it's the only way and are not happy with me questioning them. Let Robert and others treated at the VA know that they do have a new program available called Whole Health that is much more supporting of non-medicine alternatives. That's good to know. Thank you.
Wow, good to know. Good for the VA.
Yeah, agreed.
That's
Very
awesome.
good. Robert says, what would be a good blood pressure for an 84-year-old man?
84-year-old man, optimum blood pressure seems to be right around 140 over 75.
Okay. Julie says, I don't need my brain to shrink. Agreed. I
No.
don't. I don't either.
Use it or lose it. That's the rule for your brain too.
Okay. Dwayne says, I don't take any meds or supplements during a fast, so I just need to know how much like sodium, magnesium, potassium, and calcium per day that I can take that'll keep me in a fasted state, but prevents muscle cramping. I think Dwayne had said he woke up in the morning with a cramp in his calf when he was fasting. So what do you do about that?
Well, if you're fasting and drinking water, there's electrolyte solutions you can put in the water that include calcium, magnesium, sodium, potassium, they're generally pretty low dose, just enough to keep your electrolytes up so that you don't get cramping. A lot of that cramping is not because of an inadequate intake. Most of the cramping is because of changes that are happening because you're fasting. Your body needs to move things around and use things differently, and all these changes that are being different. For example, just the energy system has to be different when you're doing carb, and all of a sudden there's no carbs. It's like, oh, what do I do now? Well, I've got plenty of fat on my body. Look at all this fat. I could use that, but it takes actually about 3 days to fully convert. So what do you have in the meantime? You have you get cramps easily because it requires energy to pump the potassium into the cell. So while yes, it is electrolyte imbalances that are doing this, it's not imbalances because you didn't take any, although you can take some and improve that somewhat. So, um, so yeah, electrolyte solutions are good. I've had people that have these kinds of issues do like a bone broth fast, and that seems to work.
Okay. Beverly says I use Pedialyte to keep electrolytes up. I don't know
Oh,
what's in
well,
Pedialyte exactly. I mean, do they put sugar and stuff
sodium.
in that?
Yeah, it has a lot of sugar, sodium or sweetener there if you get the one. Yeah, but it has salts in it.
Okay. All right. Julie says my holistic doctor didn't like that I disagreed with having not as low a cholesterol. He thought cholesterol should be lower than 200, and I think it should be 220 at least. Don't you think being too low in cholesterol is bad for you?
Oh yes, yeah. There's a lot of evidence for that. Yeah, brain function. It's really important to have a cholesterol over 200 for getting your hormones, keeping that hormone balance. You know, a lot of people don't realize that going through menopause, women need hormones, and their adrenal glands are making these hormones. But if you don't have enough cholesterol, then you can't make those hormones. So cholesterol is actually really important, and cells, regenerating cells. Every cell membrane requires cholesterol, or you can't make a cell. So if you don't have enough cholesterol, then you don't regenerate cells very well, and so you don't repair your body very well. So yeah, the cholesterol is super important.
Julie said I was feeling I was aging too rapidly and I lowered the cholesterol medicine.
Oh, good work.
Uh, okay. Roy said, my friends have been pushing me to try CBD gummies that have no THC. They say it helps brain and memory function. They also brag about blood pressure control. Is there any benefit or OH no things related to CBD with no THC gummies. Hey, I will say one thing. When I had knee surgery, I used CBD without the THC, and it took a lot of inflammation out of my knee. Like I felt a lot better, almost like an alternative to an ibuprofen. It worked really well for me. So
Were you
just a
using
thought
the
about that.
gummies or the cream
Actually, I was using a liquid drops.
drops?
He's asking about gummies. I was using drops and I used that internally, and then I also applied it topically.
Yeah. So CBD it still works on the cannabinoid receptors, but it's different. THC stimulates or binds to the cannabinoid receptors. CBD provides your body to make more endocannabinoids, they're called. And that's so you make your own. That's why you can't get high from CBD. It because it doesn't stimulate the receptors. It just allows you to make more of the of your own. So your own body makes it, and it does tend to lower inflammation. I've had people use it for sleep and had it very successfully, and I've had other people say, "Blech." They take it and they go, "Blech, I hate it. It made me feel horrible. I didn't sleep at night." Various other things. So, so I, as to whether you should use it or not, I don't know. It's worth a try. I don't know of a downside to CBD. I don't know of any downside. I know that for little children with a certain type of seizures, the dose of CBD, the prescription dose for CBD is 400 milligrams for a little baby. So that's a pretty high dose, and it stops the seizures from happening in the brain. So, just kind of to give you an idea, that it does affect the nervous system, and it does affect the um, the immune system as well, decreasing inflammation. So, how it affects you might be different. I don't know.
Interesting. Okay. And Anne said the CBD helps my broken ankle feel better so I can sleep. Interesting.
Yeah.
Okay. Uh okay, I think that's it for today. Anything
Awesome.
else? No. Okay, thank you, Dr. Saunders. We'll see you next week.
Okay, bye.
And all of you, thank you for joining. Again, go to bartonwebinar.com where you will find information about our products and a link to our YouTube channel so that you can watch all of our replays. We have enjoyed having you guys here. This was a great topic, great discussion.